ago, I started Synergy eTherapy, which is an online counseling opportunity for people to get therapy from their own home by phone or video. We deal with a variety of mental health concerns, including depression, anxiety, family or relationship struggles. We work a lot with kids and teens, especially older kids and teenagers who really enjoy using the internet or what seems to be like a FaceTime. Our flexible and convenient times for appointments is really appealing to families. We have several providers that you can see in Minnesota that have different expertise, and we allow people to be seen pretty quickly. So when you're in your own home and you can be comfortable on your couch or wherever you'd like to be to have therapy, we've noticed that people are comfortable faster. When people visit Synergy eTherapy on the website, they can choose their therapist and they can schedule a free consultation, and that allows us as therapists to understand who they are and what their presenting issues are, and we get to determine if eTherapy is the right modality for them. And they also get to ask questions. Very caring thing to ask somebody if they are suicidal. And if they say yes, that really opens the door for the conversation to begin and for them to start healing. All you need to say is, "I'm here for you and we will get help together," whatever that means. It's okay. I'm here for you. I'm glad you told me. I'm glad you're talking about it. We don't have to have the answers. So if somebody is actively suicidal, there's two things you really need to do. Number one is call 911. Get the police involved. You don't have to handle this on your own if they are actively suicidal. Number two, if you can, get them to the local ER, to their emergency room, and get them assessed and evaluated there, and they will determine what needs to happen next. Now, if you're watching this right now and you've thought of suicide or you feel suicidal, number one, you're not alone. You're not broken, and this is not your fault. Suicidal thoughts, depression, anxiety, these things affect millions of people all across America and all across the world. So you're not alone. If you can, ask somebody for support. Seek out a friend, a family member, a pastor, a rabbi. Just talk about how you feel. It's vulnerable and it's scary, but finding the right person can be very helpful. Number two is to know that there's so many community resources. And if it's not therapy, it could be yoga, it could be karate, it could be just walking outside or getting involved in a running group. Doing something to engage your wellness is amazing. When a family comes to a therapist and they're presenting issue, that's what we call it, why are they coming to us? When they say, "We're here because we lost our son, we lost our dad, we lost our grandpa to suicide," and this is pretty common. What we do in therapy is we allow a lot of room for them to process their anger and their hurt and their guilt and their sadness and all the things that they may be feeling, and really allow them that space without judgment and without pressure to have ups and downs and to do it in a supportive environment. So when a client comes to me and they begin therapy, it's important that we do a really thorough assessment to understand their past, their family, and their present. And we really learn the driving forces behind why they're there and why they're feeling what they're feeling. And then the second part, what we do, is we really help them to understand how to cope effectively and what they can do to help calm their mind and their body and to find more balance. Shout Out Loud is an event where we want families and children to learn about mental health in a positive way, in a fun way, so that they can start talking more openly about it with their family.